Hi, everyone. Thanks for being here. My name is ToniAnn Loftus. I'm the owner of Seaport Speech and Feeding in New York, New York. And today we have Marcelina with us, who's going to share her expertise. So, why don't you introduce yourself?
Sure. Thank you so much for having me. My name is Marcelina. I'm a pediatric speech language pathologist. I specialize in infant feeding and swallowing, work in the hospital setting in a neonatal intensive care unit for the past 5 years. And then I also work with ToniAnn and some wonderful clients here in the New York area as well.
I love that the field of speech language pathology is so diverse. Like, you can work in lots of different settings and with lots of different families. And I think it's so cool that you're able to do that home care piece. When I spent some time in the hospital, I was like, oh man, you see the baby and then you send them off the way. You see the client, you send them off the way. It's kind of nice to be able to like follow up and see people in the home, because I feel like as a mom, like, you go home and you're like, oh, I hope I could do this on my own.
Definitely. And that's what really drew me to pursuing working with you guys and working with clients in their home because I see them in this very specific setting in the hospital where you have so much support and so many people around you. And I really wanted to support those babies and those families and parents in the home as well. And then also for like myself to see their trajectory and their progression with feeding and swallowing and all of that.
And then across the lifespan, because like it doesn't just stop with feeding and swallowing. It's like, oh, what are the next talking milestones? What are the next, motoric milestones? So it's kind of cool to kind of watch the whole lifespan of kids, and be able to support families along the way. So walk us through your journey. How did you end up as speech language pathologist? How did you end up pursuing your lactation consultant certifications?
Yeah, it's actually kind of funny because I didn't even know the field of speech language pathology really existed up until I was in high school and I was really trying to pick a major to go into college. And I knew I wanted to work with people and especially work with kids. I had always worked with children with disabilities. I always volunteered with Special Olympics. I did working with children with Down syndrome in schools and things like that. And I wanted a field that really allowed me to work closely with these people. I considered going to medical school or other things. And one day I literally just sat down with a list of available college majors. And I read through all of them and their descriptions and then what type of job paths those go down. I just tried to match myself, what matches with my interests, my strengths. And then I came across speech language pathology. It felt like a great fit. And so I applied into those majors for college. I also was always really interested in research. So I was interested in a field that would allow me some research opportunities as well. And I really liked like we mentioned before, the variety of settings that you can take this field, that you're not really locking yourself into okay, for the rest of my life, I'll be in a school or I'll be in a hospital or something like that, as my life changed, my interests changed, I could kind of figure out what setting best suited me and the people I wanted to work with.
That's what I love about our fields. Like, it really can be whatever your current interests are. You decide you want to work with voice patients, and like you decide you want to, work in a school, or you want to work in lots of different settings, or I became a mom and I became like, oh wow, the feeding across the lifespan. I didn't have a lot of experience feeding newborns and infants. It was just the nature of working in a school. And so then I was like, oh wow, this is like my new niche thing. And then it changes across. So that's what I really love about our job. What made you want to work with infants and families specifically?
So I've always been interested in infants and then counseling with families and things like that. But it wasn't until I had my first medical placement externship in grad school that it was an adult placement actually, but they had a NICU, a neonatal intensive care unit, and a speech pathologist that covered that. And for the end of my placement, she knew I was really interested in babies and families. And she was like, you know what, usually we don't take students into the
I was
NICU,
gonna
but
say,
yeah.
that's so lucky.
Oh my gosh, I'm still so grateful to her, and she's a mentor that I've kept up with, and we still stay in touch, and it was fantastic. But it was I remember my first day stepping into the NICU with her and watching her, the way she interacted with the babies and with the families and holding the baby and feeding them, where I was like, oh, this is it. This is where I want to be. So I got really good training through her and then another clinical externship. And then I ended up getting a job at that same hospital where I did my clinical placement. And they created a position that was split between NICU and then the general adult hospital floors. So with that, I was really lucky to get some really good training. And then I moved up to New York for a NICU program that was starting up here as well.
What's something about your work that surprises you when people hear what you do?
I think generally people are surprised that a speech language pathologist does feeding or swallowing. that's not, I think, common knowledge. I think a lot of people are like, babies don't talk. Why are you in the
What are
NICU?
you doing here?
Yeah, are you babbling therapy with them? So I think that's always a surprise. I think also, I think people don't realize that there's a lot more to feeding and swallowing than just like what we can see, and like the
Right.
whole additional aspects to it and the implications on like the entire life. And then also the safety like concerns with feeding and swallowing when there is something going on wrong. You know, not everyone really understands what it means when to like choke or have something go down the wrong pipe, and then what that leads to like long-term implications for their feeding, swallowing, but also their lung and respiratory health.
So how does your speech pathology background help inform your work with your as a lactation consultant? How do they overlap more than people expect, or how do they not overlap? What made you want to pursue this?
Honestly, it felt like a very kind of like natural next step with working with babies with feeding and swallowing, because breastfeeding is such an important portion of early feeding and swallowing. And it's a big goal of a lot of moms and parents. So, like, to better support them and their goals, I felt like it was the logical next step to kind of find like the best information to support them with. So, I started pursuing my certified lactation counselor. It's been so fascinating. There's so much I've learned, and like so many different aspects of breastfeeding that you don't think about and that are different from bottle feeding. So we're also getting a lot of information about bottle feeding and breastfeeding, and then like parents trying to navigate all of that as well. They're both, you know, rooted in the same like general anatomy and physiology and like, you know, function of feeding and swallowing. So yeah, it's been a really cool and informative kind of like next step to help support families both in the NICU, but then also once they get home.
Totally, totally. What are the most common feeding struggles that you see? And then when should a family reach out for help? That's like our number one question. There's always like that. Here's my question, but when should I be concerned? When's the red flag?
Yeah, I think that's such a hard question because, you know, every case is so different. I think if, you know, the parents are concerned, I don't, you know, I think sooner rather than later is always a good idea, always to at least get it checked out or get like another set of eyes. I think the most common kind of like feeding struggles we'd see in at least like early younger children is low volume, you know, of intake. So whether that's with the breast or the bottle, they're not taking like enough during a feed. So they're eating like either feeding very frequently. So it feels like, you know, every like hour you're feeding the baby another bottle. They're feeding for really long times. So, you know, the baby's at the bottle for like 30, 45 minutes, an hour, and then by the time they're done it feels like it's time to like feed them again. And then as they get older, I feel like a lot of the times we see parents that need a lot of support or families that need support with transitioning to solids. It could be for a variety of reasons, whether it's, you know, their motor development, they don't have the ability to really like sit up well and straight on their own, it's the textures, it's, you know, have something GI going on, gastrointestinal, that they're having a lot of reflux and things like that. So I always recommend, you know, if the parents are concerned, I first recommend checking in with your pediatrician and making sure, you know, everything's on check, there's nothing you're missing, check the weight, the growth, all of that. And then if they recommend any further like evaluations or testing from like a GI doctor or anything like that. And then if you're still feeling like you need extra support, then do not hesitate to reach out for a feeding and swallowing evaluation.
Totally. I'm always like from like the not the wait and see, but the check and see camp. I feel like a lot of times, I mean, I remember I had to go with my first and have him wait every week. He had
Yeah.
bilirubins were high. It was really hard to gain weight. It was the middle of COVID. It was really hard. But that was such a stressful time. And I remember like saying like, you know what, I'm just gonna check with a lactation consultant. I think I'm just gonna have some outside support. And I think honestly that like mental health check of my own of someone being like, this is okay. I'd be like, okay, we're okay. And they're like,
Yeah.
you know, I'm not like red flag, but here's some things. I remember the first day the lactation consultant came to my house. He drank like 9 ounces, and she like weighed him, and she's like, I've never seen a baby do 9 ounces. I'm like, that's a lot of. Is this? She's like, is this thing working? And she like measured him again. She's like, holy cow, that was insane. And I was like, yeah, he's hungry. And so like I felt like that check of like, okay, like that coordination, like she's like, keep doing what you're doing. And I was like, I don't know what happened, but we're just gonna keep going. Like, could you come one more time? And I always tell families that too. Sometimes families are like, can we have like a check-in? Can I have just, and I was like, listen, I'd rather come to your house and be like, continue on. Then you'd be
Yeah,
like 6 months down the road, you have said like, I keep saying something's up, I keep saying something's up, and then something ends up being like, oh, this tiny little tweak, and you're like, I could have made 6 months way easier for you.
absolutely. Yeah. I think especially when it comes to breastfeeding, I think the earlier, if that's a goal of the parents, you get that kind of initial check or that initial help, the better. Especially if it's something like the latching is painful or, something that could dissuade you from being able to continue breastfeeding if that's your goal. And then you find out, like you're saying, a couple weeks later that it could have been like a little tweak and you would have been able to maintain. Then, yeah, absolutely. I think getting that checked out and getting in earlier.
Totally. So what is a myth about breastfeeding or infant feeding that you'd like to bust?
Oh my gosh. I think one I would love to bust is that as far as flow rates go, faster is better. That the baby always just needs a faster flow rate. If, they're taking a long time to feed or stressed out or shutting down or pushing away the bottle, a lot of people jump to like the faster and faster and faster flow rate. And especially with babies that are born prematurely or NICU babies, that's not always the case. So I think doing like a comprehensive evaluation and figuring out what exactly is the best flow rate for the baby and how to help them best manage the feeding in a comfortable and efficient way. And then I think another myth I'd like to bust about feeding in terms of breastfeeding, I think a lot of moms just worry about that they don't have enough milk, that they're not feeding enough, that they're not giving enough because we're so used to seeing in the bottle exactly like, baby took 4 ounces, 5 ounces, whatever it is each time. And I think just like giving moms the assurance to like trust their bodies and trust their milk production and trust their babies and listening to their babies' cues.
What kinds of other clients do you see at Seaport?
I feel like I also work with feeding and swallowing clients, but also like you mentioned, like picky eaters has become kind of niche that I'm getting more into and actually really enjoying. I really am enjoying working with these like older kiddos and viewing food and eating as more of like an exploration from like a sensory or even like creative or like interactive perspective and working with them to like figure out exactly what's going on and just getting them more comfortable and also just to have fun with
Great.
the what they're doing and bring back that like joy around food and around meal times. So that's something I've loved. And in addition to that, anything that's like, oral motor, like those kinds of things. And I've always had like a soft spot for children without autism and doing those kind of more like developmental based approaches.
So outside of work, you're a baker, which I think is so cool. Your cakes are beautiful. And I did see you're a crocheter as well. Can you tell us a little bit about that?
Yeah, I feel like gravitate towards things that are very like tactile with my free
Cool.
time.
Yeah, I love
I,
that.
I like need something for my hands to do so that my brain can just like unwind and like run through passively like everything that happens and I need to, my hands need to be busy in the meantime. Like I can't just like sit still. And I've always been interested in like creating in the arts. My mother is an artist. She's a painter. She painted this painting
Oh,
behind
wow,
me.
that's beautiful.
Yeah, it's huge. It's gorgeous. And my entire like house is filled with her artwork. But I grew up around the arts and around creating, so it's always been like an outlet for me. And especially with crochet, it was something I learned very early on. And it's also a very kind of like fluid process that you can like start at one small point and then it grows, but you can change so much as you go. It's not, I think, as structured as knitting where you kind of like have a pattern you need to follow, you're like going down one way. So it's really good, I think, as a way to like unwind, but also like creatively just like process something and change along the way. And I think our jobs require that so much that we're constantly getting input from our clients or getting input from what's going on and adapting to that.
Totally. I'm a big needle pointer. Love
Oh,
only like
really?
a different stitch. And so like I can like kind of measure the last couple years of my life based on like what project I'm working on. So you're like, oh, that was a really
Yeah,
stressful time. That pattern, that ornament's very busy. Or like it's very like
exactly.
simple. Like I sometimes when I'm very stressed, it's like a mundane thing. Like it's the same stitch
Mhm.
over and over. I don't get fancy and like I don't because I don't have to think. It's like on autopilot. And I feel like that's so helpful to have like that cool creative outlet. Have you finished the veil?
I have not. It's somewhere next to me, out of arm's reach, but I'm still working on it. It's almost long enough, and then I'm adding this like lace
So
border
cool.
around, but I'm getting so close. but I want it to have like a really long train. So I'm just gonna like keep going and see how
Amazing.
it
I had a
goes.
cathedral length train, like veil, and it was like one of my favorite things.
Really?
Is that how long you're going?
Yeah, I
Oh,
think so.
but
Yeah.
how cool and how lovely. What a lovely heirloom like you're creating.
Yeah. And I like my great grandmother and my grandmother were all like crocheters or like needlepoint and bakers. So it feels very like, I don't know, somehow like connected to them when I get to do these things. And I even have some like crochet doilies that my great grandmother made in Poland that my mom like brought over for me. And I'm incorporating them into like a dress I'm making. And so it's like a really cool way to like connect everything
That's so
together.
lovely. I can't wait to see the finished project. When I like log on, sometimes I'm like, oh, here she is. Let's see the mail. Oh, let's see the mail. That's really like really cool. And then you've done wedding cakes too, which is like not a small feat. It's not like you bake cupcakes for like the neighbors. Like you're baking wedding cakes. That's so cool.
It's something I like recently got into because I've always made cakes for like my friends and my family and events and birthdays. And then I'm getting to the stage where I feel like all of my friends are getting married and they're like, can you do our wedding cake? And I'm like, I'll try.
Amazing.
And it's been, yeah, it's been so fun. I've made cakes bigger than I ever thought I could. I made a 4 foot long cake, like a long cake for our like civil ceremony the other weekend, and it was fantastic. And then I love doing really like interesting and intricate flavors. So
That's so
they're
cool. And
really
it like kind of ties into like the joy of food, right? It kind of like ties into that in that lovely way of like I can share this with other people, which is like the point of the meal, which is cool. How other ways do you recharge after emotionally demanding days?
I think also spending time with like my family and loved ones is so important to me, to like recharge, spending time with my fiance after work at home and just like vegging out, like going through our days together and just like being there for each other. My sister lives in the city and I'm really close with my parents, and like I have a lot of really great girlfriends here, and I feel like having that community and those people around you support you is so important. So I feel like spending time with my people really gets
Oh,
me recharged again.
that village is really important, like creating it.
Absolutely.
And then you also recently wrote an article. Can you tell us a little bit about what it's about and when it will be published?
Yeah. Yeah, so it was recently published in the ASHA Perspectives. It's a case study. So it's actually about cleft lip and palate, or feeding babies with cleft lip and palate. I have the chance to work with another speech language pathologist, Meg Lyko, who's the speech language pathologist on the NYU craniofacial team. And she sees, we have like a really cool working relationship because she sees the kids on an outpatient basis, and then I see them when they're in the hospital or in the NICU. So I get to evaluate them, make a feeding plan. Once they're ready, they discharge home, and then she follows them up with them afterwards. So we work really closely together and like handing off on those babies or problem solving together. And we had a couple kiddos in a row where we noticed that they benefited from a slightly different feeding position than what would be like the typical recommended feeding position for feeding cleft babies, which is a very like upright position, because then the milk doesn't naturally go up
Right.
into the opening and into the cleft. We had been trialing using a more like a modified side lying position, which is a position that we use typically with premature babies or babies at risk for feeding difficulties, because it helps with the control of the liquid in your mouth and then your throat when you swallow. We wrote up a case study about some of the kiddos that benefited from this, and then some of like the interventions or like reasoning we had to know that they benefited, really just as like a way for other professionals or parents or families that are looking for different methods or different positioning strategies to use with their kids, to have like another tool in their toolbox to try out.
So cool. Congratulations. That's so
Thank
awesome.
you.
So thank you so much for coming today. I want to encourage parents if they have, if they were listening and they're like, oh man, this sounds like my child or this sounds like I can have help, please contact us. We're happy to have Marcelina come to your home, directly to your home, which I think is absolutely amazing. And we'll link your article at the bottom. And thank you so much.
Thank you so much for having me.